While we are a product, we need to understand that healthcare businesses are not a product, they're a service. So the biggest challenge is that you need to match the supply of the doctors or their availability with the demand, which can come at any time. It's not a product. People are not ordering a product like an iPhone, which you can deliver at any time, right? And that's what we realized, that templatized solutions don't work there. It's a pure play math problem.
Hey, y'all. Welcome back to the State of Business Texting podcast, where we talk about all things messaging. I'm your host, Zach Kunkel, Director of Solution Marketing here at Bandwidth.
And I'm Caitlin Long, Senior Director of Product Management for Messaging at Bandwidth. Zach, I'm really excited for today's guest because he is one of our 2025 Textie winners.
You might be asking, what are those? They are Bandwidth's annual customer awards, which are highlighting really outstanding use cases and creative innovations that platforms are making and creating in the A2P messaging space.
That's right, Zach. And today our winner and guest is Amol Oberoi. Anmol is the CEO and co-founder for Emitrr, and would love to hear a little bit more from your personal point of view, just about yourself. Tell us about your background and just what you're building over at Emitrr.
Sure. No, thanks. Thanks, Zach and Caitlin, for having me here. I'm equally excited and especially excited that we've won the Textie Award this year. So really appreciate Bandwidth, recognizing our effort to solve really deep problems by using SMS. Maybe I can tell you a little bit, like you said, right? I can start by telling you a little bit about what we do here at Emitrr. At a very top level, essentially at Emitrr, what we're trying to do is we're trying to solve a very large problem, deeply engraved in the healthcare ecosystem in the United States, right? Our understanding of healthcare tells us that the biggest problem in healthcare in US is not just technology, it is access. I'm sure both of you from your own experience have seen this, that trying to get an appointment in the US is super hard, even for very simple things. And the reason for that is that the healthcare ecosystem or healthcare practices are super short-staffed, right? And, World Bank data tells us that by 2030, that'll become even bigger. We'll have a shortage of 15 million healthcare staff by 2030. So essentially what we are trying to do with SMS and AI is we are trying to fulfill that gap of 15 million healthcare staff shortage by using SMS and AI to build healthcare receptionists. So what we're saying is that it's already starved for staff. The ecosystem is starving with staff shortage. Everybody's coming in and saying that, hey, AI is going to replace people. We are saying that in healthcare, we'll use AI to fulfill that gap and really help people get better access to healthcare. So that's what we use SMS and AI for, and that's what we're solving for at Emitrr.
That's awesome. Maybe a little bit, why was that problem so attractive for you to solve? I'm always interested as a founder, co-founder, there are tons of problems out there in the world, but why this one for you?
If I were to tell you the truth and not tell you, well-framed answer, like we didn't reach to this problem by design or, I think consciously, we didn't decide to solve this problem. Really, the way we've built Emitrr is by just listening to customers day in and day out. And while we went through two product pivots and while we were solving for healthcare businesses, we stumbled upon healthcare as a space. And as we kept getting deeper and deeper into healthcare, we realized that there are much bigger problems to solve. And, as a founder as well, you mature and understand that, hey, building a small company or building a big company are both equally hard. So why not go after a bigger problem? So we realized that, okay, the ecosystem we are in healthcare, if there are 100 problems to solve, which is the biggest problem right now, and given where AI is, can AI solve that problem? So really, it was purely listening to customers, being very close to customers, working from their offices, that we realized that automation can, yes, solve workflow and send out notifications and things like that. But why are customers wanting to do this? Because there's a very big underlying problem. So really, we just got to this problem by interviewing customers day in and day out, and not by it's not that both me and my co-founder have worked in healthcare prior to this.
Sure. Yeah. I would say from listening to how I built this podcast, from talking with a bunch of other guests that we've had on our podcast, that stumbled into it mentality, or phrase that you just shared is probably commonly seen. And also just love, speaking to a lot of product managers, product leaders, the idea that you were just sharing, which is having empathy, being directly connected to the customer that you're trying to reach, the business you're trying to help solve a problem for, is just a great reminder for all of us. So Anmol, wanted to just ask, I talked a little bit about the Textie Awards and how we're looking to recognize platforms and businesses that are doing some really cool things in business messaging. So wanted to share, or give you a chance to share, in your Textie's application, what do you think really sets your platform apart in the market today? Because, as I'm sure you were doing analysis, there are a lot of people who are doing patient engagement, and there are a lot of people who are trying to apply AI to solve specific problems. But what do you think the combination of those two things, what do you think makes Emitrr stand out?
To give you a very brief understanding why we are different and where we can really create impact, I'll maybe help you understand that with the help of an analogy, right? If you look at most food tech companies in the world who call themselves at food tech, but they are largely delivery companies. Look at DoorDash. Look at maybe other companies, right? Like Uber Eats also got into delivery. They are not food tech companies. Yes, they are categorized as food tech companies. But the common insight all of them had was that if you want to succeed in the food business, you need to solve the delivery in-house. Like there are listings, like you have Yelp. Yelp existed before Uber Eats, but Yelp is just a discovery platform. It did not solve for the delivery, right? Similarly, DoorDash, Uber Eats realized that if you want to make a big business, you need to solve for delivery. The food journey just doesn't end at discovery, right? You discover and ultimately you've got to get the food. In a very similar fashion, how we differentiate ourselves is we are solving for a critical problem, which is capacity utilization. What we've understood is that healthcare businesses struggle with, capacity utilization. If you ask any provider in the US, they will always say, hey, I have so much free time, I can see more patients. And if you ask patients, they'll say that, why do I have to book 5 weeks out, 3 weeks out, right? So clearly there's a gap, which is leading to poor capacity utilization. And I'll tell you what is the difference between others and the way we are solving this. While we are a product, we need to understand that healthcare businesses are not a product, they're a service. So the biggest challenge is that you need to match the supply of the doctors or their availability with the demand, which can come at any time. It's not a product. People are not ordering a product like an iPhone, which you can deliver at any time, right? And that's what we realized, that templatized solutions don't work there. It's a pure play math problem. You need to have schedules and AI to be able to take calls last minute. Like it's as simple as if you call in and I don't have an opening in my schedule, as a front desk receptionist, I'm going to say, I don't have an opening, come 3 weeks later. But can AI be smart enough to decide that this is an emergency and it needs to be addressed today? Can the system be smart enough to say that, hey, instead of providing everybody a standardized 15, 30, 45 minute slot to book an appointment, can we change that by using data to figure out that actually these type of appointments don't need 30 minutes. They can be completed in 15 minutes because in the past I've seen they only need 15 minutes. So I'm opening up more slots. So that's essentially how we differentiate. I can go on and on, but you get the drift, right? We're trying to solve and optimize the schedule so much that capacity utilization is at its peak.
Yeah. And when you're talking about utilizing AI in that capacity, not to be redundant with that concept, but utilizing AI to solve for the capacity question. I'm cheating a little bit because I know what you submitted for your application for the Texties, but I'd love to hear you go into a little bit more detail for our listeners on just what it means for you to be an AI first company and how you have pivoted your product roadmap and just the ways of working to really facilitate differentiation around the problem that you're trying to solve, and how is AI leveraging that journey for you?
Sure, absolutely. Maybe I can answer that in parts because there are a couple of questions there.
Yeah.
What does it mean to be an AI first company?
Sure.
Who has that changed for us as a company, right? Because structurally we had a lot to change. And I'll first tell you from a customer standpoint what has changed. like I said, there's a staff shortage. But from a customer standpoint, what that led to is that the AI receptionist essentially now, so maybe just to set context for the people listening to this podcast who are not necessarily familiar with healthcare, today about 40 to 50% of the incoming phone calls are dropped because of staff shortage, right? It's not just because patients call after hours or on weekends. It's also because there's staff shortage. You're always on calls. What we've been able to deliver is that we've been able to convert these 40 to 50% of the missed calls into actually booked appointments. So it's newfound revenue, which otherwise, if you think of it from a practical standpoint, if a patient calls, you don't answer, they're going to call someone else. So you've lost that revenue. It's too late by the time you reach out. So that's one of the biggest impacts that we've been able to create across healthcare practices, be it pediatric, chiropractic, dental, etc. But what it means to be AI first for us, both from a customer standpoint and from internal standpoint, right? I'll give you a very simple example. From an internal standpoint, we really took a very hard decision and we said that, hey, we're going to cut down literally all of workflow automation or simple SaaS products that we had in our roadmap. So like, I'll give you an example. We had patient scheduling as something that we wanted to build. We were about to complete it. And we took a call and we said, we're not going to do this because this is a low ACV product for us. AI seems to be a big ACV, higher ACV product. So right from engineering to product to support to sales, everybody was aligned. And we said, okay, this initiative needs to stop now, right? Because if we need to think long-term for the customer, we need to build this. But that's at a very decision-making level, right? That you're taking a decision and aligning teams. But what we noticed was, it was something that was a pleasant surprise for us. I'll give you an example of what that led to us as becoming an AI-first company. Now, when customers come to us with challenges, I have seen that product teams come to us with AI-first solutions. They don't come to us with workflow-first solutions. To give you a simple example, in terms of healthcare, a customer came to us and he said that, hey, we have phone calls that need to be triaged based on the type of the patient, right? If it's an emergency versus if it's a general appointment. Can you do the same for SMS? We get hundreds of incoming SMSs. If it's for appointment scheduling, if it's for revenue cycle management, or if it's for insurance related queries, can you automatically assign them? And typically teams would have built a solution thinking of, if this, then do this. If the message contains this, then do this, right? But they came up with an AI first solution. So the AI reads the SMS, identifies who this should be assigned to, and assigns it to the right team. So that's what the company has become now. Everybody, right from content to product to engineering, everybody thinks in terms of AI first. How can I use AI to solve a problem?
Which it sounds like translates to new and innovative ways to redeploy your existing assets or solutions that you've developed. Messaging, for example. I mean, it's just utilizing that new framework of thinking and also potential new ways of utilizing those technologies to solve customer problems and drive additional value.
Absolutely. You're absolutely right to say that.
Yeah, that's really cool. I love that.
That is cool. Amol, I would love to talk more about the roadmap, but don't want to have you reveal any of your trade secrets. But it sounds exciting. And, having called into multiple providers, because I'm in between a primary care physician right now, because we're moving and yada, yada. It's going to take me like 3 or 4 months to get this appointment. I'm like, what? How is that long? So having experienced the problem firsthand, appreciate all that you're doing in the space to help providers and patients get connected as quickly as possible. Gonna shift gears and gonna ask a little bit, what's the best text that you've gotten in the past week?
I don't know if I can call it the best text, but I could maybe answer this with the most surprising text that I got in the last, if that works.
Hey, to the eyes of the beholder, you have been given the question, answer it how you see fit.
Long story short, I actually tend to go to a library and work out of a library some days of the week instead of when I'm bored and I don't want to go to office, right? It so happened that at the library, I met a couple of people, and I basically met 2 girls who were from a church, right? And they said that, hey, we would like you to visit the church and things like that. I was traveling to Canada, so I didn't have a local number, and my wife did. So they asked me, can you share your number? And I said, okay, I'll give you a number. And I happened to give my wife's number. And it so happens that they text me saying that, hey, Anmol, it was good to meet you. We're looking forward to meeting you. And they leave their names at the bottom, right?
Mhm.
And I was like, who are these two girls? And I was like, I don't know. I wasn't able to recall. I said, I don't know who they are. And she said, and I didn't recall at all that I had that conversation at the library because it just did not strike me. 2 days later, they follow up, and then she's like, "Hey, what's going on?" and then I realized, okay, this is them. And then I clarify saying that, hey, I gave the number, and this is for a church and nothing else. So calm down. So not the best, but the best.
You got to remember what you opted into.
I walked into it.
Yeah.
That's funny. That's funny. I'm glad you clarified it for your wife, knowing, and also she knows now that you're giving out her phone number whenever people ask for Anmol's number.
Oh, that's great. Well, we really appreciate you taking time out of your valuable day to join us on the podcast. We do like to make sure that if listeners want to engage with you offline, really online, just outside of this podcast, where can they do that? Where are they able to see what you're building with Emitrr and just the best way to connect with you?
Sure, absolutely. I think I tell all my teams, never message me, but always email me. I'm probably always on top of email. So anybody can reach out to me on email, and which is anmol@emitrr.com. Otherwise, more than email, I'm always active on LinkedIn. My team tells me that sometimes they feel I'm giving them feedback by writing a LinkedIn post, and I'm building in public, so I write LinkedIn posts very often. So yeah, I think those are the two places where people can connect with me.
That's awesome. That's awesome. Well, again, I know we've said it a couple of times, but thank you, Anmol, and appreciate you for applying to the Texties. Thanks for pushing the envelope this year, and thank you to our listeners for tuning in. If you want to catch up on any episodes that we have already published, or maybe you want to be in the know on the episodes that we're about to publish, you can follow us on Spotify or Apple Podcasts, or you can watch this season on YouTube. All you got to do is search State of Business Texting. And be sure that you head over to stateofmessaging.com, where you can learn more about the rest of the 2025 Textie winners, and you can watch the full award show replay that features all 4 of our Texting winners, including Anmol. Again, stateofmessaging.com is where you can download your free copy of the 2025 State of Messaging report, and you can learn a ton of other stuff. So, Caitlin, Anmol, appreciate it. Thanks for your time, and thanks, listeners, for tuning in.